So I will be taking a first round of questions with my panelists, my dear panelists, and then later on I will address your Q&As. In order to make it smooth and flowing properly, we made it very easy for you. You go on the Wish app. If you haven't downloaded it yet, it's in your emails of batch collection or registration. You download it and you go on the session, program session, and there's this live interaction where you can send me your questions. It would make it really easier for me to address your questions, tell me to whom you would want me to address your questions, and I promise you I will try to tackle all the questions I receive from your side. First, okay. We start with you, Professor Jonathan Valabji. We heard from Dr. Abu Samra about the action plan of Qatar. From your experience in the NHS in the UK, what would you recommend for Qatar in its coming 6 years for the action plan that they're launching today?
I think the action plan is... Thank you. The action plan is very comprehensive, very impressive. It's been an honor to be a part of the work, actually, and thank you to Abdul for inviting me. Very enjoyable few months being part of that, but very comprehensive. We're talking about prevention and treatment of moving from diabetes in the last strategy and action plan to include what is intuitive, of course, obesity, the major modifiable risk factor for type 2 diabetes, and the other modifiable risk factors, so very comprehensive. I think what you're asking is, what might I suggest in terms of levering the effectiveness and of course, strategies...
And if you can share with us examples of...
Sure thing.
Yeah.
So the secret behind all of these any strategy is implementation. And what I personally found from my work in England, and was fortunate to have the opportunity to roll out a national type 2 diabetes prevention program, a remission program with universal coverage, the power of data sits behind it. And I know that's a planned part of the action plan. But actually to have fully comprehensive registers, our general practices have been paperless for over 2 decades, so that everyone with a coded diagnosis of pre-diabetes and diabetes, for example, is coded in electronic health records. Now, that has provided us with immensely powerful tools to wrap around data collection. So, for example, our diabetes prevention program, I can tell you exactly what the conversion rate was before the program from pre-diabetes to diabetes, and I can tell you what the impact of implementation of the program was on that conversion rate, and what the conversion rate is by different demographic characteristics of our population. Now, the secret behind that is that it proves to be highly persuasive. You have to bring on board, A, your population, and B, your healthcare professionals. And they're not necessarily intrinsically on board when you start your implementation, but actually showing that you can collect data and prove that your strategy, your programs of work are actually doing what's written on the tin, as we say, are working, is immensely powerful. And if you publish it so that it's in the public domain, I must say we found that is a fantastic means of winning hearts and minds, which is what you have to do to implement strategies, really. I'm
glad you mentioned data and local healthcare providers, because that would take us to Dr. Dalia Hassan, who is Senior Consultant at PHCC. PHCC has currently 31 locations across Qatar. How can the centers, these public health centers, create a more robust network of primary care centers that can make the national screening program for obesity, diabetes, and risk factors achieve the target of 75% of the eligible population by 2030?
Thank you for the question. So you've already stated we're 31 health centers. We're deeply embedded in the community. We work from 7 a.m. to 11 p.m. We have some 18 health centers that are overnight. So we are the gatekeepers of the community. Most patients will come through us for, be it a health check, school check, just their annual labs, if they're, vaccinations. So most of the people captured will filter through the primary health care. And that's always an opportunity to screen them for what needs to be screened at that point in time and what is the requirement for their age or their gender. So part of the streamline that we see is patients we are able to screen at the time. Again, things can be, further motivated. We can open more easier access for patients through, portals and e-health, and patients can be engaged also through the community. We reach out to the community. We do school fairs. We're at malls. We're at a lot of public events. So there's always a chance to screen the population, and there's always a way to capture this screening. Of course, we all have Cerner. We integrate with our secondary and tertiary care stakeholders, and at that point, we're able to sit down at a table and actually have the numbers that are needed to screen. I don't think it's far-fetched by 2030 that this amount of patients can be screened. I think it's very doable, very feasible. It's just where to capture the patient. And I think primary healthcare with 31 health centers, integrated throughout the country, and we have also outreaches to the community, would easily be able to capture these patients and make the plan of the 75 by 2030.
I'll keep trying to go back and forth between local and global. So Dr. Francesco Branca, when we're talking about Qatar's action plan, we're talking about an economically well-based state. But unfortunately, in the region, there are so many countries that are economically very challenged, and whether extremely dire situations or middle economic situation. How can we build from Qatar's initiative and action plan to other countries that are not in the same economic situation?
Well, I must say that I read with great interest this very rich document. It's extremely comprehensive. Its strong point is certainly the management part, and particularly the integrated services. I've seen some of the activities, and that's what we need. Unfortunately, very few countries actually have good systems to deal with obesity, for example. So having an integrated management program on diabetes and obesity is excellent. It is a good example. And actually, I was privileged to visit and see in practice how this integration is done. And it's also an integration not only across multiple areas of the management, but also across multiple levels, linking the community with the primary care and the secondary. So I think these are good examples. And of course, this needs the training of the whole health workers, and that's really a commitment of the action plan. I am afraid it's an expensive solution. So as you rightly say, not everybody can afford that. I imagine it's also a big burden for the country, given the high prevalence of obese people in the country. It can be very expensive. So definitely the element of prevention is something that in the Gulf area needs to be stressed. Mm-hmm. And WHO is actually encouraging countries to take on a series of prevention areas, really looking at early food environment, for example, the breastfeeding element, looking at the food environment. The food environment is unfortunately toxic, mm-hmm. because highly processed food is largely available, largely accessible, it's cheap, it's promoted, and that needs to change. So I think for the Gulf region, that element of prevention is really critical. And I was also reading another very interesting document that Qatar has produced with the support of the Qatar Foundation, really looking at these comprehensive approaches to prevention. I think that's really a good model, which would definitely fly for the region. And I think it's important that it's done at regional level. Mm-hmm. So these things, particularly the food system, is something. It cannot be individually changed in a country. It needs to be changed at least at the regional level. So I definitely think that the leadership of Qatar can be very important for all countries in the region to make a change, and make a change in the Gulf countries to have a healthier food system.
Mm-hmm. Professor Adel Al-Sayed, how do you envision the role of international collaborations? It might be expensive to implement such an action plan, but also create jobs locally. So I don't know, maybe funding could help those countries. Maybe another form of international collaboration. From your experience at International Diabetes Federation, how do you envision that role?
Thank you very much for the kind invitation, and it's my pleasure here to speak about the role of the International Diabetes Federation regarding the Qatari action plan. But first, let me say a couple of words about the International Diabetes Federation for those who might be not fully aware of the organization. The IDF, as we used to call it, is a major international organization consisting of more than 240 national members, organizations, and representing more than 170 countries in the world. And this year, the 75th anniversary of the IDF, so it's a pretty old organization. And the objective, the target, is how to improve the life and how to defend the right of people living with diabetes all over the world. And the Qatari Action Plan, actually, it's located right in the center of the interest of the International Diabetes Federation. So that created a sort of common ground between the two parties and triggered sort of communication between the two parties, just how to collaborate together. And what the role expected, just like your question mentioned, the role of the IDF in implementation of the Qatari initiative. That's by how to magnify the outcomes of the Qatari action plan by taking it to communities outside maybe the Qatari borders. And we know very well, of course, that the Qatari model, might not be suitable for every other community in the world, especially for the low and middle income countries, which are the main focus of the International Diabetes Federation. And that's why we thought that to make that collaboration, definitely we need to maybe to adapt the Qatari experience to be suitable to other areas. And one idea which has been discussed in the last few months, maybe to produce or to develop some smaller projects out of the initiative of Qatar, and then adapt them to the needs and characteristics of low and middle income countries, and then to present it to them and see and help them to implement it technically and maybe financially, subject to the available resources, of course, and see how it will work when we are trying to do that. The second issue, of course, is how to make use of the experience of the IDF and helping Qatar how to implement the action plan here in Qatar. These are the two major things, and during the last few months, we had several meetings actually with people. I'm happy to see, and I would like to thank Dr. Abdul Badi, Abu Samra, Dr. Abdullah Hamaq, Dr. Mohammed Al Thani as well. He's not there, but they shared some meetings with the International Diabetes Federation. The last meeting actually was just 10 days ago with Dr. Peter Schwartz, the president of the IDF, was here. So we are now discussing and preparing the protocol of the collaboration between the two parties. And one last point I would like just to mention is the International Diabetes Federation organizes a global conference for diabetes every 2 years. And Qatar applied to host the coming conference, which will be held in 2027. And 1 month ago, when the global board of the International Diabetes Federation met in Abidjan, in the capital of Cote d'Ivoire in Africa, they discussed the location of that meeting. And well, it was nine international cities applied actually. And the result or the decision regarding the location of the conference will be announced in the very near future, maybe within this month, and I'm pretty sure that we'll have good news. Well, we are not allowed to disclose the results of the board. So that's, I mean, a sort of well, this is a sort of up-to-date briefing of the communication and what happened up till now regarding the collaboration between the two organizations. Hopefully, will be announced, fully announced before the end of this year in the coming few weeks.
I can only hope that all the IDFs of the world are as peaceful as yours.
No, it's International Diabetes Federation.
I know, I know. That's why I couldn't say it IDF shortly. It was like too political for me. Dr. Abdullah Al-Hammaq, how do you envision the role of Qatar, especially from the Qatar Diabetes Association, in raising awareness of the public? Because one of the main things is raising awareness.
Yes. Yeah. The Qatar Diabetes Association, which is a member of Qatar Foundation, in fact, is established in 1995, and it's a based community organization. So the main goal, the ultimate main goal, is to educate people about diabetes. So, and most of our programs actually is good for educations. So through for organized camps for the youth, camps for the children with type 1, and also educate the people who's I mean the patient, and also people is that not a patient, so
who are not sick yet, or who are not diagnosed.
Yes.
Yet. Yeah.
So as you know that 50% of the people, they are undiagnosed for the diabetes, and I'm proud to say that also the Qatar Diabetes is the first who did the national survey for diabetes in 1999 at that time, and then in 2010. We collaborate with the Hamad Hospital and do the second one of national survey. And then now just Dr. Abdul mentioned that the third stepwise survey is carried out now in 2003. So if you look to the programs, we are just focusing on educations. And also we know that, strongly we know that the GPs in the health centers, they don't have a time to educate their patients. We know that. So most of the health educate, the GPs and others, private sector, they advise the patient to go to the Qatar Diabetes for education. We have a certified diabetes health educators. Dr. Abdul mentioned that we start also educate, organize the diabetic health educators for the nurses, dietitians, pharmacists to be certified diabetic health educators.
Professor Abu Samra, you have two roles. You are part of the National Diabetes Committee, and you are the director of Qatar Metabolic Institute. How do you foresee the action plan impacting diabetes and obesity care pathways across Qatar's healthcare system in the coming 5 years?
So, you know, I outlined in my presentation to emphasize, so we think obesity and type 2 diabetes, perhaps it's one disease, and at different stages. And so the team so we are raising this awareness within the PHCC, and so collaborating extensively with them to be the initial contact with the patient for management of both disease based on the stage. And toward that, we have provided active training, both online as well in person, and will be certifying a good number of them for obesity management. Within QMI, we have National Diabetes Center and National Obesity Treatment Center and National Bariatric Center working together in harmony to treat the patient actively. And through this active treatment, we think we will be able to manage the extreme end of the obesity, which is BMI above 30 or above 35, to bring it down to below 30. So the QMI, working with prime healthcare, and in the future, we think the private sector will take a major role, so we'll be able to manage obesity. Managing obesity, reducing it, will reduce diabetes prevalence or incidence, and will cause reversal or remission of diabetes. So that's why when we think about the problem as one single problem, we think we will be able to achieve the objective of this action plan. Reducing obesity and diabetes will reduce also atherosclerosis and cardiac disease. And I think I'm hopeful with the involvement of all the society that this action plan will be successful.
Let's take the first round of Q&As because I have a lot of questions addressed to all of you. I will try, those who are addressed to the panel, I will try to address them specifically. So I will start with you, Dr. Jonathan. Dr. Amne Toussi is asking, can you please elaborate on the actionable steps needed to prevent child obesity during pregnancy?
Thank you for the question. A very challenging question, I think. I think the measures are universal. We've used the hook of childhood obesity because it's more emotive. It achieves buy-in, winning the hearts and minds. But much of what you have to do to achieve it is the same, whether you're talking about high prevalence in adult populations, high prevalence in children, or preventing in children. Any single action that you take, I would argue, has a small effect size. And so I've been asked many times over the years in the childhood obesity space and more globally in the obesity space, what's the magic bullet? What is the single intervention that we should do to make a difference? And I've always tended to push back and say, actually, there isn't a single magic bullet. You need as much in your portfolio as you possibly can fit in. And I have to say, in terms of what you've already got in your portfolio in Qatar, you've got more than we have in England at this point, with many more interventions planned, which is fantastic. But you have to go from the population health measures, which are low cost, tiny effect size, and I'm talking about, for example, a fiscal measure, a tax on an unhealthy food, sugar in foodstuff, for example. You have immense reach. It will touch almost all of your population, that action. Its effect size is tiny and its cost is low. To the other end of the scale, where you've got, let's say, bariatric surgery, which is high cost, much more limited reach in terms of how many people you can actually direct towards that intervention, but much more significant effect for the individual affected. And I would argue you need everything. My narrative, I hope, may be able to change in the future, because what we don't yet know, and is a very exciting time, I think. We've now got therapeutics. We've now got drugs that can cause weight reduction of 15 to 20% in the trials of body weight. Now, at this point, access is difficult. There are global supply chain issues. But quite where that'll take us and whether that will have a much bigger effect size of its own right, I think is the exciting space to watch in the years ahead. And, one would hope that the cost of those drugs will fall. And we also have a pipeline of drugs that show promise, GLP-1 agonists, combined GLP-1 GIP agonists, and we've got glucagon receptor agonists as triple agonists. Sorry, that's a mouthful, isn't it? Coming online in the future, not licensed yet. So potentially exciting times in the drug space in terms of treatment, but in terms of the prime question, pack your portfolio with as many different measures as you can possibly get in there is what I would suggest.
Thank you. Allow me to welcome His Excellency Sheikh Dr. Mohammed Al Thani, Director of Non-Communicable Disease Program at the Ministry of Public Health in Qatar. Before I go back to the Q&As, I know I have a question for you, Dr. Branco, but allow me to address the question that I had first for Sheikh Al Thani. How does the Ministry of Public Health plan to leverage community partnerships and outreach programs to implement prevention strategies for diabetes and obesity effectively across different population segments in Qatar?
Thank you so much for this question. And as you know, that our diabetes strategy started as early as 10 years almost from now. So this strategy had helped us to grow in different aspects in the country. And part of it is partnership with the others. So we believe, of course, in Qatar with the PPP, public-private partnership, and we are moving forward in this one. You can see here we are aligned here with Hamad Hospital, primary health care, our Qatar Diabetes Association, the National Diabetes Federation, Dr. Al. Our colleagues are all here connected. So this partnership is growing to be more effective because we have built in the ministry the interministerial committee that we need to work with other ministries to support us. And we have many memorandum of understanding with companies. Some of them are medical companies, some of them are non-medical companies, but this is to align our work together. We are hoping now even more to invest this even in the education in different aspects, not only in schools or universities, but even in other training sessions to be aligned for diabetes. We are hoping even to invest more smartly in the early training, like physical and nutrition activity. We are aligning with the taxes authority to have more taxes on sugary drinks and other issues. So the idea of diabetes, alhamdulillah, has been spread well in Qatar in the last 10 years, and everybody know the blue circle. And we are looking forward that this will be more effective in the coming years because we saw, and the government is convinced, if you protect diabetes, even you are protecting cardiovascular disease automatically. So it's a big vision together as invested in this one. And we are hoping colleagues here coming from everywhere, we are always open and welcome for new partnership with any one of you if you think that there is something can be add idea, especially in a summit for innovation. So we are welcoming you, and this partnership has a plan, and with launching the action plan, there's a part dedicated for this. Now we have a steady steps to do to go forward in this partnership with other colleagues. Thank you.
Dr. Francesco Branca, Dr. Dennis Losek is sending a question. I'm guessing he's asking about Qatar, but I see that we can ask the question globally. Are there plans to implement AI-powered data-driven solutions to optimize the proactive management of ASCVD, chronic comorbid patients? Comorbid.
I mean, I come from a background of public health. So I do believe that you need to change the environment in order to be able to change individuals' behavior. It seems that this idea that you can target individuals and change them according to their specific needs and using maybe this new tools that allow us to better characterize the individuals are the future. And I probably think that the truth is in between. So we definitely need to see how the environment is changing, and can these tools allow us to better change the environment. And for example, one challenge we have is to map the availability of healthy foods. And is there a possibility for these new tools to help improve the availability and the access to healthy food, for example, by designing zoning policies, by helping people to know where to go to find healthy food at a reasonable price. So maybe that's something that would help. Helping doctors to make the right choices in terms of their treatment solutions, yes, definitely that can help. Integrating data on the level of risk of individuals, yes, that can help. But I think that, and I'm very pleased to hear from Dr. Haltani that the ministry is really willing to go to the avenue of creating that healthier environment. I think that comes first. And then, those tools that will help us understand the people and understand the environment will help. But I think the public health strategies are critical to create a supportive environment.
Dr. Abdullah Al-Hammaq, I have a question coming, let me get the name, coming from Dr. Dr. Tala Abu Sam'an. How does research fit into Qatar's National Action Plan?
The Qatar Diabetes Association also collaborates with the main institution in Qatar. So we do some research with, for example, with the Qatar University and also with the Weill Cornell, the School of Medicine here in Qatar, helping, to facilitate the research there, and also with the QBRI in the Hamad Medical, in the Hamad University, Hamad bin Khalifa University. So we do confess that the research is very important for diabetes. And whatever any institutions want to collaborate with the Qatar Diabetes, we are more than happy to do.
Yes, sure.
We have a collaborative program I mentioned, which is the Qatar Diabetes Prevention Program. And that program is extensive, engaging QDA, engaging primary care, engaging our partner, academic partner, primary health care. And the objective of that program is to learn what is the best here in Qatar to prevent diabetes development from prediabetes, to prevent diabetes development from gestational diabetes, to prevent gestational diabetes development in women who are planning pregnancy and who are at high risk, or to cause remission, long-term remission of diabetes in people who have recently diagnosed diabetes. And that program, I think, will teach us a lot here in Qatar about what to do. I know many of these have been tested somewhere else, and maybe our program add an extra level of intervention, and will become very relevant to the context here of Qatar. And that's what research, I think, will be very helpful.
Professor Adil Sayed, we have a question from Isra. I know it was addressed originally to Dr. Dalia Hassan, but I'm taking it globally, not only in Qatar. In your opinion, is health content in social media helping to raise awareness about diabetes in the Arab world? Of course, I'm asking this question. Or on the contrary, probably.
Thank you for a question which have very wide boundaries, actually, because the social media biphasic tool, actually, and well, in spite of having a great benefit when they are used in the correct way, let me put it like that. On the contrary, we are suffering actually from the
false information, probably.
Yeah, and yes, there are a lot of allegations and things without any scientific base, without anything, because it's the easy way of getting just jump to the social media and say whatever you would like to say. And there are people actually who are very successful to attract people without any scientific base. I don't know how to control that, but when the social media is properly used, definitely, it's an excellent sort of giving the right information to people. The outreach, the very huge outreach of the social media, is very beneficial in using them, and especially when you adapt the material you are going to deliver to according to the characteristics of the specific community you are dealing with. There are a lot of advantages and gain from the social media, but the only point I'm very all the time I'm obsessive regarding it is the misconcept, the bad information which are spread through the these negative aspects are doing a very big harm, actually, to
the latest trends on social media is that we are all suffering from insulin resistance, and that we should stop tomatoes. So can you confirm or deny any of those two?
That's one thing.
I don't know. There's a thing about tomatoes. Apparently, since 2 weeks, I keep getting videos that tomatoes raise the sugar. So
Yeah.
yeah,
Tomato is healthy. Tomato is very healthy.
Thank you.
Totally agree.
Very healthy. Eat more of them.
Eat more. Thank you.
Neglecting diabetes and shifting to insulin resistance, and that's it.
Yeah, exactly.
Insulin resistance is very high, and here in Qatar, it's very high.
Yeah.
And so it's a precondition to prediabetes, and prediabetes precondition to diabetes. And main cause is nutrition, lack of physical activity, as well as obesity.
You fight insulin resistance eating a lot of fiber. So fruit, vegetable, legumes, whole grain cereals, that's what you need. No?
From Dr. Muhammad Al-Sharif, we have a questions that I will address to His Excellency Sheikh Dr. Muhammad Al-Thani. How are projects on tackling obesity prioritized in Qatar? How are projects on tackling obesity prioritized in Qatar?
Yes, now it's clear for us. Thank you for the question. And now obesity is very clear. It's not a risk factor. It's a disease. Now we are agreeing. You cannot see people are moving obese. It's a free country. You should know that it's a disease and you need to take care about it. We saw very clearly many people with obesity when they did any bariatric surgery or lowered their weight in different reasons. The diabetes went up them. So obesity is becoming very tackling, and we're having a big plan for obesity in children and adults. You know, many companies now are working hard with us because to invest more in lowering obesity, because there's a lot of products coming now for obesity, to lower obesity, and it can be valuable because it can lower diabetes. So please, you are going forward that you start by obesity because it can handle a lot of cases very clearly. You know, there's always a case you can't understand why the diabetes is happening genetically or stress or other issues, but the obesity is always a risk. Whenever you find people obese, they have a high risk. So a big plan is coming soon, inshallah. We have the action plan here, and part of the action plan, it have a lot of obesity, and part of this action plan is a dedicated part for children obesity. So it's clear, inshallah. You can see now all the Qataris now are less weight. And you can see any friend you know last 10 years, now they're having lower weights, and this is proven by different reasons. So we are hoping that this will be invested more, and we are working on more controlling the sugar in any appetite, welcoming the culture, as mentioned, doctor, even the hotels, they are giving you smaller cakes now anymore. You know, we are finding that always there's option for diet, putting the calories for everything. These things will keep controlling obesity. The good thing, obesity is not like hypertension. Hypertension have asymptomatic. You can't know that you are sometimes hypertension. You can't know the symptoms. But obesity, everybody can see the symptom from far away. And we can always find techniques for different people. There's many techniques. If you can find one proper tactic or technique you can do, you can lower your weight. So we'll keep trying till we find the best way for every obese person. Thank you.
From Ms. Fatima Muhammad to Dr. Abu Samra, we have observed a growing trend in bariatric surgeries among the youth. What awareness campaigns are being conducted to help reduce these?
Yeah, so prevention, of course, is key. So preventing obesity is key, but unfortunately, we have some youth come with very, very extreme increase in weight, in which medical management and lifestyle management doesn't work, and the family and the child are wanting to have bariatric surgery, and the team here, they will do and help this family. Ideally, we do the prevention and the medical management, and hopefully we don't reach that point. Mm-hmm. So our strategy here is to focus on prevention.
Dr. Dalia Hassan, I have a question for you. How does PHCC envision adopting person-centered care to foster lifestyle changes in support of the action plan's goals?
This is actually a very good question. We are now working on this actively. Basically, primary health care has enveloped certain services to help introduce patient-centered care and raise the platform for management. Now we have like annual health checks, we have complex case management. You find people with one or two diseases, obesity, diabetes, they present to our health center, and that's what you see on every day. This is our daily bread. But they come in and you find out that this person's treatment plan is not written out on stone for them. You have to assess them and give them personalized care tailored to their needs. And this is what we're doing now through most of our clinics and our specialized clinics. Plus, at the same time, we're bringing in these patients for screening, identifying their needs and placing them on appropriate treatment that follows their goals individually. You have patients who will come in and they've been diabetic for years, on medication for years, they're just there to refill their prescription. You spend some time with them, you find out this patient will actually benefit more of not touching his prescriptions, but let's say establishing, having him see mental health support, you know. And then this now shows that they're showing, and you look at the outcomes, a lot of people have changed their A1Cs, their weight, their blood pressure. A lot of changes have happened just because you have tailored care to this patient at this point of time with their needs. We have care coordinators, we have case managers, all of them are just geared towards the patient who is in the center, and that's what we revolve doing all the treatments that they need individually. There's one thing I want to say, and it's about the Google issue, Dr. Google. You know, our patients are coming in and they're like, I think I have, you know, God forbid, probably brain cancer. Why? I've headache for 2 days. I didn't, you know, I drank water. I felt dizzy. My eye was seeing flashlights. I went on Google. I think I have cancer. I need a CT scan, an MRI. I need to be referred to oncology. So this is, you know, social media and can be a problem. But, you know, if it's geared to the right people with the right communication towards the right patient, it can be a plus. So, you know, we're always in the balance. Is it a plus? Is it a minus? So when I come with someone who says that, we're like, okay, we have to stop social media here. For others, I'll be like, well, you know, you can research this a little bit more, you know, seed cycling for fertility, ovulation. But the thing is, you know, it can be your friend. And for us in PHCC, we see a lot of it. And it needs to be addressed. And maybe, you know, more positive might negate the negative in social
Maybe
media.
we should do more videos of awareness of how to actually find the good medical information online.
And it's not
That
Dr.
could-
Google. Or now I have Dr. TikTok too, you know.
it's
another
worse,
one.
I can tell you. Yes,
YouTube.
Yes, and as not Google, we're trying to do in Qatar our own app and our own information that anything you want in diabetes in Qatar, we'll have an AI that will get the questions and the frequent asked questions, and all these questions will be filtered and know what you are concerns. And by this one, you can go to this translated to different languages in our system, and you get the answers from us, not only from Google, and you know, get misinformed sometimes from the confusing data you get. This we are working on this, and we are hoping with AI we can understand more how to get the people, everybody tailored what they need of information all the time in their pocket. Thank you.
Thank you very much, Your Excellency Sheikh Dr. Muhammad Al Thani. Thank you very much, Dr. Abdullah Al Hammaq, Dr. Dalia Hassan, Professor Adil Al Sayed, Professor Abdul Badi Abu Samra, Professor Francesco Branca, and Professor Jonathan Valabji. Thank you very much, everyone, and thank you for all the questions. Thank you.